Here is another brain. As we blow it up, you could quickly see that many of the blood vessels within the brain are severely cuffed by inflammatory cells, as is the brain substance proper. If the overlying meninges were also inflamed, then this would legitimately deserve the anatomic diagnosis of a meningoencephalitis. If we look at the cells which are inflaming the brain and the blood vessels within the brain, the first thing you'll notice is that the stain does not look as pink as usual, and that's because we did not use eosin and hematoxylin in the usual way on this. We stained it more preferentially with a stain called PAS, which is periodic acid Schiff stain, because that's a stain that stains fungal hyphae very nicely. And notice that you see these little rods inside these inflamed areas, like here. In some areas they appear to be tangled up. These are fungal hyphae, and technically it could be any fungus. Sometimes one way to determine what kind of fungus would be to look to see if these fungal hyphae branch at 90 degrees, like they do here. And if they do, then you could limit it to a certain numbers of fungi that branch at 90 degrees. And a common one is Mucormycosis. That is a fungus that can infect the brain, and when it does, it usually infects the brain in patients that are severely immunocompromised. So this is mucormycosis, meningoencephalitis, and we showed you the encephalo parts. I didn't really see any meninges on this case, but I'll believe it. Here's another area where you could see the septae are branching at 90 degrees. You can see a nice little T over here. And if you look around, you'll see more of them, but I can guarantee you that all these little red things are picking up the PAS stain very nicely because they're part of fungus. Thank you very much.